Did you know that diabetes affects some 26 million Americans? And approximately 80 million Americans are considered pre-diabetic. It's a big medical problem that can really affect the lives of people with the disease if it's not treated properly. Luckily, there are a number of medications available to help treat diabetes. And today on Medication Matters, I'll tell you about a new drug used to treat type 2 diabetes that was recently approved by the FDA. The drug, Invokana, works in a brand new way to lower your blood sugar. Join us to learn more. So how does Invokana work to lower your blood sugar? Invokana works in your kidneys. That's right, in your kidneys. Your kidneys constantly filter your blood 24 hours a day. Liquid from the blood is filtered into the kidneys, bringing with it all the liquid waste that your body generates, as well as a lot of the good stuff, including sugar, that your body wants to keep. The kidneys then separate the good stuff from the bad. The good stuff gets recycled back to the blood, while the bad stuff ends up in your urine. Invokana lowers your blood sugar by preventing the sugar that's filtered into the kidneys from being recycled back to the blood. So the only place it can go is into the urine. In fact, almost 50% of the people taking Invokana brought their blood sugar down to safe levels. It just plain works. And for those people with diabetes who are having a hard time getting their blood sugar levels down with their current medication, adding Invokana may just be the ticket. Now, does Invokana cause side effects? Every drug out there usually has some type of side effect, and this is true of Invokana as well. What are these side effects? There was about a 5 percentage point increase in the number of men and women that experience yeast and urinary tract infections. Because sugar from the blood is not being recycled and instead is going into the urine, the yeast and bacteria that cause urinary tract infections now have more food energy to grow. Again, there's only about a 5 percentage point increase in these infections, but it is something to watch out for if you're prescribed Invokana. A very small percentage of people had their blood pressure drop below normal, resulting in things like dizziness when they would stand up or get out of bed. This was mostly seen in people taking certain blood pressure lowering medications. So if you're taking blood pressure medication, make sure to tell your diabetes doctor. And make sure to talk with your doctor or your pharmacist if you have symptoms of dizziness when taking Invokana. Finally, Invokana slightly increases bad cholesterol, so it's important to keep a check on your cholesterol levels if you've been prescribed Invokana. But there are added benefits associated with the medication. As I've already mentioned, it lowers your blood sugar levels, keeping your diabetes in check. The drug can lower your overall blood pressure, which may lower your chance of heart disease. And finally, men and women lost an average of 7 to 9 pounds of body weight over a 26-week period, which is certainly a positive benefit for people with type 2 diabetes. So while there are some side effects you should keep an eye on if you're prescribed Invokana, there are added benefits with taking the medication. Now the big question, how much is the medication going to cost? Invokana is a brand new drug and the cost is relatively high. A spokesperson for Janssen Pharmaceuticals, the makers of the medication, say a monthly prescription without insurance or a copay is approximately $300 a month. Well, don't turn me off just yet because I want to tell you about some options available that can really help lower the cost of the medication. Janssen Pharmaceuticals offers a free 12-month drug savings card for those with insurance coverage that would bring the cost down to no more than $5 a month. That's right, $5 a month max. So if you've been prescribed Invokana, I put a link in the description below that takes you to the website so you can get the card. And if you're on Medicare or you don't have insurance, I've included a link below that directs you to Janssen Pharmaceutical's Prescription Assistance Program. And here's a hint. If you've been prescribed a medication that's brand new on the market or isn't a generic drug, check with the manufacturer's website to see if they offer a drug savings card or prescription assistance program. Many of them do. And your pharmacist should also help you with this. But always remember that medications are usually not the end-all and be-all as far as treating a disease. Lifestyle changes, diet, and exercise can contribute as much, if not more, to combating your specific disease. and this is particularly true when it comes to diabetes. Thanks for joining me today on Medication Matters, where the more you know about your disease and the treatments available, the healthier you'll be. Take care.